Now, you've been talking a lot about members of Congress who use the Federal Employee Health Benefits Program, but who dispute the merit of the current legislation. Can you expand on that?
Sure. As I mentioned earlier, when you really sort of boil down where the real change is in this healthcare bill, it really is to set up a structure that will go online 2013, 2014, that will allow individuals and small businesses to buy in with the benefits of bulk purchasing insurance. That's exactly the system that we have right now for members of Congress after they get sworn into office and are given their voting card, is that they get to participate in the Federal Employee Health Plan, which is a large purchasing exchange with lots of choices of health care plans. We know from that program that it does far better than the private insurance market that individuals have to buy into without the benefits of spreading risk. And it provides a very comprehensive, high-quality level of health care. What galls me is, to go out on the floor and listen to members demagoguing this type of approach, saying it's going to get government in between the patient and the doctor, when they know from their own interaction with the Congressional Health Care Plan that that's the same program they use, and there is no damage done to the patient-doctor relationship, which is one of the reasons, by the way, the AMA has endorsed the House bill, because they know that we're strengthening people's access to health care, we're not damaging it.
Now, Congressman Courtney, do you participate in the Federal Employees Health Benefits?
I don't, and I don't by conscious choice. When I ran for office, I made a promise to my district that I would not expect them as taxpayers to pay for my health insurance through the Congressional Health Care Plan until every American had the same opportunity. If you calculate what the dollar value for members of Congress who may have a family and elect to choose one of the choices that they get, I mean, the taxpayer is paying roughly about $7,000 to $8,000 on average for a member of Congress. So, when you think about that, they are getting the benefits of a large purchasing pool, and the taxpayer is footing the bill for 75 to 80% of the cost of that health insurance. And to watch many of these folks then turn around and say that this is going to be a disaster for all Americans, I mean, it's beyond hypocrisy. It's almost comedy.
So finally, the question that's on the tip of everyone's tongue, now that it's clear there won't be a vote until September, where do you see the legislative process going from here?
Well, hopefully it will go in a positive direction after people have had a chance to digest the three committees' efforts and to give the congressional staff and the leadership an opportunity to craft a good melding of all the bills, and that hopefully by early September, we're going to come back really with a strong caucus and lots of majority support. The trick is, though, is that we can't lose the public debate. And what I would just say to the people who read your post and participate, with the Huffington Post, is that they really have got to be engaged. This is not a spectator sport. This is a street fight right now, and congressional offices are getting bombarded from opponents that, again, are using many of the misleading allegations, which we talked about. And it's really important for people to call, email, write, get their friends to do it. You may have a member of Congress who is on record supporting healthcare reform, but frankly, it's important for their office to hear support for it, because at some point it becomes demoralizing around here, even for supporters, when they just see the phone tallies coming in opposition. So now's the time. We know from 1994 that when efforts like this don't make it, it's not like it just is, well, wait till next year like baseball. I mean, it could be literally a generation before we have really, until we have the political alignment to take it up again.
All right.
So we can't fail. Failure is not an option.
Great. Thank you very much.
All right, Kit.